Ministry of Health of Ukraine. Krok 2. Medicine. Year 2020, number 054. A 19-year-old young man was diving and hit his head on the bottom of the pool. He complains of pain in the neck. His head movements are limited and painful. During examination, his head is bowed forward and to the right, and the patient supports it with his hands. Palpation detects tense neck muscles and protruding spinous process of the IV cervical vertebra, C4. When pressure is applied to this process and to the head, axial load, the pain intensifies. Make the provisional diagnosis. A. Uncomplicated cervical fracture. B. Complicated cervical fracture. C. Spinal root injury. D. Cervical contusion. E. Neck muscle injury. Neck stiffness is a broad term for anything that makes it hard to move or use the neck. It is mostly a temporary symptom of overusing the neck or sleeping in an unusual position, but it can also be a symptom of meningitis that needs treatment right away. Neck is a complex network of bones and tissue, including vertebrae, discs, muscles, ligaments, and nerves. Cervical nerve IV, C4, controls the upward shoulder motion and is one of the nerves that controls the diaphragm for breathing. C4 provides sensation for parts of the neck, shoulders, and upper arms. Most cervical spinal cord injuries are the result of axial loading, force directed through the top of the head and through the spine, forcing the head into hyperflexion and/or rotation. This type of mechanism may result in a fracture or dislocation of one or more of the cervical vertebrae. A fracture of one or more of the cervical vertebrae does not necessarily result in a spinal cord injury unless the fracture or dislocation results in damage to the spinal cord, that is housed deep inside the vertebrae in the foramen, protected by bone on all sides, followed by ligaments, and then muscles. The spinal cord can suffer irreparable damage. The answer is A. Uncomplicated cervical fracture.